Speech pathologists deal with communication disorders and swallowing problems. We can also call them speech-language pathologist or speech therapist. They are part of the allied healthcare team. Do not forget, these clinicians do not work with children only. Speech therapy for adults also exists. So, what does speech pathologists do? They evaluate, diagnose, and treat speech, language and swallowing disorders. After proper diagnosis, they conduct speech therapy to treat their clients. Have a look at a summary of disorders that they treat. Communication disorders have various categories which include the following. Number 1 is speech disorders. In this case, patients face difficulty in speech articulation or production. This results in the disruption of normal speech. Different components are important to assess. These are as follows: respiration, phonation, resonance, articulation, fluency, prosody, which includes rhythm, stress, and intonation, and last one is voice. Few examples of these disorders are as follows: articulation disorder or phonological disorder, stammering or cluttering, apraxia of speech or developmental verbal dyspraxia, dysarthria, and voice disorders like hoarseness or puberphonia. Number 2 is language disorders. This category includes problems in expressing or understanding the language. It may include spoken or written language and graphics. They affect different aspects of language which include syntax, phonology, morphology, pragmatics, and semantics. These disorders include aphasia and development language disorder. Next in the list of is cognitive aspects of communication. Different cognitive processes play an important role in communication. That's why the speech therapist works on different aspects of cognition. These include memory, problem solving, attention, comprehension, reasoning, and awareness. Next is learning disability. It includes problems in which patients face difficulty in reading and writing. Examples of this category are dysgraphia, dyscalculia, and dyslexia. Apart from communication disorders, SLP also treats swallowing disorder. It is a difficulty in passing the food from mouth to stomach. This process includes sucking or biting, chewing and swallowing food or liquid. The term used for swallowing disorders is dysphagia. There are 3 types of dysphagia. These are oral, pharyngeal, and esophageal dysphagia. SLPs deals with the first 2 types of swallowing disorders, while the third one needs other medical treatment. The role of a speech-language pathologist is not just having a conversation with a client. Their scope of work is way wider than people usually think. To know more about the profession, take a look at the SLP's job description. A comprehensive evaluation of speech, language, or swallowing disorder. Follow standardized procedures of evaluation. Diagnosis of the disorder. Creating a management plan according to the needs of a client. Identify short-term and long-term goals. Identify the right therapeutic approaches and tools. Conduct speech therapy sessions. Maintain a record of every client about assessment, session notes, progress, etc. Reassessment after a particular time to track the progress of the therapy. Change of treatment methods according to the need. Counseling of the client's emotional or psychological concerns. Interaction with the client's family to educate them. It is important to tell them about the disorder, therapy, cautions, etc. Train the family or client for home-based tasks. Coordination with other healthcare professionals in a particular case. Refer clients to other medical professionals. Maintain the physical environment of the therapy room, which is helpful in learning. Use of a variety of tools used in therapy. Communication with other departments about the role of an SLP. Maintain proper schedules of different clients' sessions. Check for billing of clients. Knowledge of hygiene precautions in the clinical environment. Now I am going to tell you how to become a speech pathologist. To become a professional SLP, you need to have a speech pathologist degree and license. Let's talk about the speech therapist education first. A lot of universities are offering bachelor's and master's programs. Students with a bachelor's degree go for master's in speech pathology. It is important to know the prerequisites of a speech pathology degree. Different universities may have different criteria. Universities may require a speech pathology bachelor's degree for the graduate program. It takes 2 years to complete a master's degree. Some institutes are also offering doctoral program. Various institutes offer a speech pathology degree online. These institutions use various mediums to teach their students online. Some of them offer live classes, online apps, and field placements. Technology is helping to ensure better learning. In the USA, 300+ institutions are offering the Communication Sciences and Disorders program. It includes both graduate and undergraduate speech therapy degree. Major subjects of the course include linguistics, development of speech and language, the introduction of communication and swallowing, and management of disorders. Students need to complete clinical experience under the supervision of certified SLPs. This includes observation hours and practical hours set by a university. Students also need to pass the praxis exam. They have to complete CFY clinical fellowship year. Most noteworthy, you need to have a speech therapy license for clinical practice. Different countries may have different requirements. In the US, you should have a Certificate of Clinical Competence, CCCSLP. Those who want to work in schools may require a teaching certificate. You can consult the government education department for this purpose. Different countries have different requirements for employment. It is important to ensure them before pursuing the field. In the United States of America, clinicians must have a master's degree in speech pathology. It should have accreditation from the American Speech and Hearing Association. Remember, one must have great theoretical and practical training to excel in this field. You must also have some soft skills to become a good speech pathologist. These include communication skills, time management, etc. You must have strong interpersonal skills and flexibility for teamwork. Also, candidates must have adequate hearing and vision to execute the duties. Let's talk about the scope and work areas of an SLP. Speech pathologists can find various opportunities to provide their services. They can find jobs in the following work areas. Their biggest opportunity is a hospital where they can work in different departments. Here they can get good experience by working with different types of disorders. Relevant departments include audiology, ENT, neurology, neurosurgery, pediatrics, psychology, oncology, and other allied healthcare departments. Jobs for an SLP in hospital is very challenging, but it gives great command on practical work. Speech therapists can also work in independent rehabilitation centers where they can work with other health professionals like occupational therapists, physiotherapists, and behavior therapists. They can start their independent clinics according to rules and regulations. Not only health practice, speech-language pathologists also work in schools and universities. They work with students with special needs and help them in communication and swallowing. In colleges or universities, they teach and train students to become great professionals in this field. Let's talk about speech pathologist salary. The annual salary of a speech and language pathologist is $78,000 in the United States of America. Some sources state that it ranges from $60,000 to $90,000 per year. The starting salary ranges from $41,000 and $70,000. Those who are working on an hourly basis earn $51 on average. Don't miss these facts in this regard. SLP salary in hospitals or other healthcare services is higher than in schools. Administrators and supervisors get bigger paychecks. Payslip tells that experience does matter. Experienced staff earns more than newbies. Clinicians in urban areas earn more than those who work in suburban or rural regions. I hope you got the answer to who is a speech pathologist. They are as important as any other healthcare professional and career is flourishing. The growth rate in employment is more than 15% as compared to others. According to the stats, we can have more than 145,000 speech pathology jobs during 2016 to 2026. We wish you the best of luck if you are looking forward to joining any program. If you are giving speech and language pathology services, we are proud of you.
Do not forget to share your thoughts about the video in the comment section. See you again, goodbye.